I agree with you entirely that we have, I think, overemphasized that you must be safe to engage in physical activity during pregnancy, probably to the point that it's been more harmful than helpful. And certainly, if you look over time at physical activity guidelines, they have changed wildly. ACOG, American College of Obstetricians and Gynecologists, didn't have their first statement on pregnancy physical activity until the mid 80s.
Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. Hey everyone, I'm your midwife, Tanya Tringali. Welcome to the Motherwit Podcast, a show about the issues we, healthcare consumers and providers, face every day as we interact with the medical system. We'll talk about its blind spots, shortcomings, and share strategies we can use to feel seen and heard, no matter which side of the table we sit on. My guest today is Meghan Garland, a PhD prepared certified nurse-midwife. Her clinical work focuses on low-resource and farm worker populations, on providing high-quality and respectful care. She's also a published researcher in the academic literature and has contributed to textbooks that will help shape the next generation of midwives. Meghan recently completed her PhD at Rush University and has expanded her body of research to examine the gaps between physical activity recommendations and physical activity behavior among pregnant women. I've shared links to some of her work in her bio, which you can find in the show notes. Today, Meghan is here to share her dissertation research, which examined the influences of theoretical and non-theoretical determinants of pregnancy physical activity among pregnant Black women. This foundational research will inform the development of culturally tailored physical activity interventions. As you know, if you've been listening to the show, the U.S. has the highest maternal mortality rate of all industrialized countries, and Black women are 3 to 4 times more likely to die due to pregnancy-related complications, and that is neither due to genetics nor socioeconomic status. Neither of those things can explain this disparity. Racism and stress are to blame. However, physical activity is associated with lower rates of hypertensive disorders of pregnancy and gestational diabetes, and I'm sure that's part of what brings Meghan to this work. It's certainly part of what brings me to this work. Meghan, thank you so much for joining us today.
It's wonderful to be here. Thank you so much for inviting me onto your podcast.
Oh my goodness, I'm so excited to have this particular conversation. I think it's going to be different than any conversation I've had on this show before, in that it's kind of got an academic bend to it. I mean, this is your baby, this is your work, this is your dissertation, right?
That's right. It took me 7 years to give birth to this baby.
That is crazy. So I have so many questions for you, and I want to hear a little bit about the process. And I know that we have listeners who are considering doing something like this themselves, but have some fears. And so as much as I want to talk about your work, I also want to talk about just your feelings around doing it and advice for people who might take this path. But before we do all of that, tell us a little bit about yourself.
Okay. Well, let's see. I've been a midwife since 2002. What inspired me to become a midwife was actually my undergraduate degree was in anthropology. And so I did some examinations of birth practices cross-culturally. I guess I'd always been fascinated by pregnancy and birth. I always just thought it was really interesting and cool. And I learned that Western medicine is not the end-all, be-all of birth practices. Shocked my little 19-year-old brain. But it was an eye-opener that, that Western medicine had gone into different cultures and really kind of mucked things up. not taken what they could learn, just really sort of imposed what they thought was right. I'm making air quotes here. Um, and I wanted to learn more. So I started looking a little bit into the history of midwifery in the United States, and this was actually from having a college job, working in an organic restaurant that had a magazine section, and I was at work one day on my lunch break looking for something to read and picked up a copy of Midwifery Today. And my first thought was, wow, I thought they burned all the midwives as witches. So I opened Midwifery Today and started reading and was like, this is so interesting. Why is it that midwifery doesn't seem to be more widely practiced in the United States? It wasn't visible to me in my community. And so I started digging into the literature because I'm a little nerdy science girl, and discovered that there was good evidence for midwifery care. It just wasn't mainstreamed into American medicine. And I really came away from that experience thinking, boy, every woman deserves a midwife. And that I could be that person to provide that type of care. And so that's really kind of how I got started. So I went from being an anthropology major, finished my anthro degree, enrolled in nursing prereqs, went to nursing school, and after a couple of years of practicing as an RN, applied to midwifery school.
But you became a nurse always knowing you were going to be a midwife.
Yes. Yeah. Yep. I made a conscious decision about, do I want to be a nurse midwife? Do I want to be a direct entry midwife? I went through that whole process and, evaluated what I thought was going to work best for me in my life and decided that I would pursue the nurse midwifery route. But I've certainly enjoyed working with my direct entry colleagues over the years as well. So there's more than one way to be a midwife.
Yeah, totally. Well, this conversation is already really fun for me because I know you, but I don't know you that well. But now I know we have some other things in common. I too thought all midwives had been burned at the stake. That was exactly my, thought when I found a midwife to take care of me when I was very young and pregnant. And something I've never forgotten. And I too explored all the various paths to becoming a midwife and ultimately became a nurse, even though my goal was to be a midwife, because I didn't have a bachelor's degree at the time, and it didn't make sense to, finish my degree in theater and dance and then start over again. You know what I mean? Right. So yeah, I love hearing people's journeys into midwifery. So, okay. From there, I think there's probably another piece of history for you that might be relevant, because obviously we're going to interface with this conversation around physical activity and exercise. So I'm assuming that you have an athletic background as well. Is that true?
I did some sporting activities growing up. I played volleyball very poorly, but very passionately in high school.
I love it.
I grew up in Michigan, downhill skiing on, basically frozen sand dunes, and, enjoyed that. But I never really considered myself an athlete, but I enjoyed being outdoors. I enjoyed being physically active. So, I was more of like a recreational, hey, let's get outside and do something kind of person.
So how do the two worlds collide?
Oh, gosh. I think probably the sort of like little kernel that, first sort of like has grown into this giant plant was when I was pregnant myself. And I kept my gym membership. And the looks that I got from people were just stunning. And, and it hadn't really occurred to me that I hadn't really seen pregnant women in the gym. People really looked askance once I was visibly, showing my pregnancy. And it just sort of like was like one of those little things I sort of tucked into the back of my mind. Why aren't there more pregnant people in the gym?
Are you able to think back to when fitness was just something that was interesting to you in the context of pregnancy and how you have changed, kind of clinically speaking, in terms of how you talk to people about this topic once upon a time, and not just talk to them, but how you incorporated it into your care then versus now?
Yeah, that's a great question. So, I guess that in my clinical practice, I always recommended being physically active, but didn't really sit down and talk to people about what that meant to them, those kinds of things. It's like I had my spiel, that was like, being physically active during pregnancy is very important to you and your baby's health. You can kind of hear it in your brain,
Yeah.
And it really wasn't until I was asked to write a textbook chapter. This was, many years ago now, about lifestyles while pregnant. And it was sort of this grab bag textbook chapter that covered working, covered sexuality, covered like lots of sort of topics, aspects of people's lives during their pregnancies. And one of the included topics was physical activity. And that was the first time I really sort of jumped into the literature. What specifically about physical activity is good for people? And one of the things that came through loud and clear was that there was fabulous evidence for the benefit of physical activity. I mean, basically, name a concern of pregnancy, being physically active is going to make it better. There are really very few things that physical activity don't improve during pregnancy. But very, very few people were able to be physically active during pregnancy, and no one knew why. People were trying interventions. Researchers were out there doing different things with, providing, home exercise, thinking, well, if people can do it at home, they'll do it. Or no, they need to be in a structured environment with a specialist, and this is what's going to get people to be physically active. And none of it worked. And so that was really, just like when I read that, the literature about the evidence of midwifery and decided that, I was going to be that midwife. I read this literature about that we didn't have an understanding of why people weren't able to either engage or maintain physical activity during pregnancy, and said, well, I guess I'll have to be the one that's going to develop that evidence. And that was kind of what got me started on the track to doing a dissertation and starting to develop my own body of research.
That is so cool. I mean, I know our audience can't see us, but I'm kind of grinning from ear to ear. My cheeks kind of hurt because you're talking about like my two favorite things that I love so much. And it's so nice to hear that kind of totality of your experience and how, I love that analogy of how you found midwifery and how you, ended up becoming so passionate about physical activity. Those two things really, really resonated with me. That's so cool. Okay, this actually segues nicely into how we actually met. Mm-hmm. And so Meghan and I met because we were co-authors on a chapter in a textbook that will be coming out this year, in a textbook called Prenatal and Postnatal Care, a Person-Centered Approach. That's the name of the book. It will be the third edition of this book. And just like you pointed out in your first chapter writing experience, in the first and second edition, the chapter that we worked on was a little bit of a catch-all, maybe an improvement from where yours was way back when. But the catch-all was sexuality, environmental exposures, and exercise. And they were all thrown in together. And that always bothered me about this book. It's a book that's very near and dear to me. And it bothered me that exercise didn't have a standalone chapter. And it was something I was like making a strong case for. And so Meghan and I came together. And Meghan, as you are starting to gather, has this really wonderful focus on physical activity. I have this kind of like technical experience around exercise and with a little bit more of an emphasis, or a lot more of an emphasis on, athleticism, I'll say. And honestly, Meghan really opened my eyes to a whole part of the equation that I don't think about enough. Like I have a little bit of tunnel vision on the part of exercise that I love the most and the population that I like to work with the most. It's a very technical skill. But Meghan brings this midwifery perspective, for lack of a better word, to what most people engage in day to day. And so this might sound stupid of me to say, but I had not even fully accepted that physical activity and exercise were not synonyms until I started working on this chapter with Meghan. And that's why Meghan's on the show with me, because I think that what Meghan does is so much more accessible than what I do. And so with that said, I definitely want to give Meghan lots of time to tell us about her work and her research. And I've read some amount of the paper that I understand will soon be published. Is that
Hopefully this year I will get my dissertation research published. It will happen.
Well, I've had the pleasure of reading that, and I definitely have lots of questions. And I think that this is a topic that's really interesting to people who listen to this show. We know that people who listen to the show are healthcare consumers in many different ways who are interested in the perinatal period. But we've also got healthcare providers of all kinds of stripes, obviously plenty of midwives, but I talk enough about physical activity that we've got pelvic floor physical therapists who listen. And I just think there's a reason why anyone listening to this show would find your work so interesting. So tell us a little bit about this study.
Okay. Well, first of all, let me say a little bit more about the distinction between physical activity and exercise, because I do think that that they are words that are used sort of interchangeably. And certainly before I really started on my journey, I kind of use those terms interchangeably too, but they're really they are considered different things. So exercise is sort of planned recreation. That's the way that I sort of conceptualize this. So these are choices that you make to engage in a behavior that is specifically intended to increase your respiratory rate, increase your heart rate, burn calories, whatever your goal is for that. And physical activity is really everything that you do during the day. So when, I pour out dog food into my dog's dish, out of the heavy bag, that is physical activity. I am burning calories. I am exerting myself. It's a combination of strength to hold the bag and cardio to drag the bag over to the dog dish to pour it out. It's where it falls into different domains. So it can be physical exertion at work. It can be physical exertion in transportation activity. So if you walk to the bus stop, that is physical activity. It's not planned recreational activity, but it still burns calories. It still, is increasing your heart rate, respiratory rate. So, and to my mind, that's more accessible for people to think about, because one of the concerns or barriers that people often express is they don't have time. Mm-hmm. That is a big barrier to being physically active. But it may be that people are thinking about it only in terms of, I don't have time to take out of my busy day to do this planned recreation. Whereas if you can get them to think a little differently about everything that they're already doing, if you are walking up and down stairs at work, that is physical activity, or in your home,
if you're chasing your toddler, if you are vacuuming your home.
Absolutely. It all counts. It all counts. And if you can say, okay, well, I'm already going to do these things, but maybe I'm going to do them with a little bit more vigor to increase my intensity, then you're actually getting more physical activity. And so that is potentially a way that people can increase their total activity without taking any extra time.
So it's interesting lately, and probably because I met you, a thought that has been occurring to me is that people can engage in exercise, planned recreation for their hour a day, let's say, but otherwise be sedentary. And so I have thought a lot about that, because I feel like what you're doing is actually combating the 23 hours of the day that is not what I'm working on. That's
Yes.
been one of my repeating thoughts since I met you.
And there's a whole separate set of literature on the effects of sedentary behavior, and I think it's starting to sort of get out into public consciousness now that sedentary behavior will undo your physical activity.
Yeah.
That if you engage in too much sedentary behavior, it doesn't matter if you're getting that hour a day of planned recreation. And that was something, boy, you better believe that was on my mind while I was chained to my computer writing my dissertation.
I'm sure. I'm
That's
sure.
how sedentary my behavior had become. And, and so, yeah, the lifestyle physical activity is a way that, if people can make a conscious decision, okay, I have a 30-minute lunch break. I'm going to take 10 of those minutes and I'm going to walk.
Yep.
They're still not taking any additional time, but now not only are they increasing their energy expenditure, they're also breaking that sedentary pattern. If you just, and I'm certainly guilty of this, eating lunch at my desk, or just moving to a different room to sit and eat. I should try to be more intentional about saying, okay, well, maybe I'll run down to the laundry room. I live in an apartment building in Chicago, so I've got to go down a couple flights of stairs. I will go throw in a load of laundry over my lunch break, and just to get on the stairs. And, I'm sort of killing two birds with one stone, because the laundry's not going to do itself.
So on that note, I'm so glad you stopped me from launching right into your research, because that was so important. But it also reminds me of one more thing I think we should actually mention before you launch in. And that is, can you talk a little bit about the guidelines around physical activity for the general population, but also just for people who are pregnant? And I don't know if you have any points to make specific to how the physical activity that you're focused on relates to how we talk about it when we're talking about quote unquote moderate activity, moderate levels of exercise.
So the recommendations for pregnancy physical activity are no different than they are for the general adult population. So that recommendation is 150 minutes weekly of moderate to vigorous intensity physical activity. So, and during pregnancy, we really focus more on the moderate end of the physical activity spectrum. There's certainly not anything wrong with engaging in vigorous activity, but there are anatomical and physiological changes that happen during pregnancy that may make that less accessible. And we certainly don't want to introduce any new barriers. One thing that we don't know is what is the minimum threshold of physical activity that's efficacious. We just don't know that. We're very focused on the sort of standard guideline. In fact, the ACOG guidelines specifically talk about planned recreation. They don't even talk about lifestyle physical activity. And I don't think that this is an intentional thing. I think this is just the way that it got written. Because American College of Obstetrician Gynecologists are not exercise physiologists. They're not steeped in the lore. But that's how the guidelines are written. And we also don't really know the effects of sedentary behavior specifically on pregnancy. Pregnant people are just hard to study. And I don't think anybody would disagree with that for lots of reasons, and possibly some reasons that we've done to ourselves over the years. Those guidelines are helpful in that it sort of can give you, for someone who's very motivated, a goal. If that's something that's helpful to an individual. But it can also be a barrier. And it can be that you can give the impression that if you're not achieving this 150 weeks of moderate intensity physical activity that we know is associated with improved health outcomes, that anything less than that is not worth anything. And that's not true either.
Yeah, we don't want to throw the baby out with the bathwater.
Exactly.
But it's unfortunate that we're not at a point where we can make a statement like, I'm making this up, this is not real, 300 minutes of low intensity movement equals that of 150 minutes of moderate. Like, it's a shame that we're not at a place where we can make a bold statement of that nature. Or do you think it's like a moot point?
Hey
Hey everyone, it's me, Tanya, your host here at the Motherwit podcast. You know I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Motherwit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.
So it's interesting. I do think that there is pretty wide recognition now that that pregnant people, if they're physically active, tend to engage in lower intensities of physical activity. And so we may not even be recognizing the activity level that people are actually engaging in with this fixation on moderate intensity activity. And even in my own research in my dissertation study, I did focus on moderate intensity activity. But part of that, it's like almost a catch-22, because you want your study to be able to be compared to other studies. And so if everybody is looking at moderate intensity physical activity, then you sort of have to look at moderate intensity physical activity too. Otherwise, you can't really compare, at least in a small dissertation study like what I've done. But certainly looking forward, I am interested in measuring lower levels of activity, having measures, and you are starting to see this more often, just sort of broadly in the physical activity literature, measuring sedentary behavior separately from physical activity. So yeah, so things are changing. Things are changing, but it's everything takes time.
Totally. Okay, you've hinted at a few things already, so now I think it's time to tell us a little bit about your study.
Okay. So the one aspect of my study that we haven't really talked about yet is that I focused exclusively on Black pregnant people. And I was very intentional in doing that. First of all, Black pregnant people have been virtually ignored in this literature. Most of the studies that have been done on pregnant people have been overwhelmingly done in white, well-educated, middle-class populations. And in those studies that did include a sufficient sample of people of other races and ethnicities, there was no subgroup analysis. They're just sort of lumped in. There was one study that I looked at that was actually done in a national sample, so it had a huge number of participants, and they looked at white people and then everybody else. So they lumped every other race and ethnicity into this sort of other category, which just is really it just feels gross. It's just
Definitely
not right. It seems it's white norming, and we see this throughout the medical literature, that white is your reference, and then everything else is somehow different. Yep. Or that whatever we know about white people can automatically be applied to people of other races and ethnicities, and this has sort of been the dominant paradigm for a long time, and it needs to change. So the other reason that I was very interested in looking at a sample of all Black pregnant people is because this is the population in the United States that is experiencing the greatest amount of maternal mortality and morbidity, and I'm sure the population for your podcast knows that very well, so I won't belabor that point. But a couple of the more common complications of pregnancy, specifically gestational diabetes and pregnancy hypertension, both of which physical activity actually improves. It can prevent it and it can treat it. And you would think, well, gosh, this should be, super accessible to everyone. But as we've said before, apparently not. And we don't know why. So I wanted to know for my dissertation research, what factors influence Black people's pregnant Black pregnant people's physical activity behavior. And so I was looking at characteristics that, are sort of reside within the individual, like how confident are they to be physically active, um, relationships that might affect a person's feelings about being physically active. So, social support from their family and social support from their friends to be physically active. And then I was looking at factors that sort of are broadly exist, outside the individual. They all affect the individual, but they may not be things that the individual can affect as much as their confidence or their social support. So, their neighborhood characteristics, experiences of discrimination, and also various demographic characteristics, so age, education, income, sort of those sorts of factors. And then I measured people's physical activity by having them wear a physical activity monitor. So this was a research grade monitor called an accelerometer. And then they also answered survey questions about what their physical activity was like during their pregnancy using an instrument that was intended for use in pregnant people. And then I looked to see what are the relationships, what are the associations between these different factors, to see if there was anything that seemed like it could potentially be either a factor that needed to be accounted for when you're looking at, well, how can we potentially develop an intervention that might help improve somebody's pregnancy physical activity. For example, sometimes people will cite lack of childcare as a resource, and if it looked like people who had already had children had more barriers to being physically active, that could be something that potentially needed to be accounted for in an intervention. Or, did it seem more like internal factors, that it was really their confidence to be physically active, whether they were receiving social support, if those things seemed to be affecting their behavior. And there are some things that were known from those prior studies that had been done on white, well-educated, middle-income women that had been identified as potential barriers or potential facilitators that could be, targeted in an intervention. And what I found in my study was that none of the things that had been identified in white pregnant people seemed to be influence the behavior of my sample of Black pregnant people. Now, of course, this is just one little snapshot of folks residing in the Midwest. All my data was collected during the pandemic. There were definitely factors that could have influenced things, and it could have just be just the sample of people. But it does point to an idea that you can't take what has been done in other countries with other populations and say that, okay, these factors are somehow universal and apply to every pregnant person's experience. So really what this dissertation taught me was that I have a ton more to learn.
I guess that's the way it is with every study, right? I mean, most studies are going to raise more questions than they will answer. And that's what then propels the future of more and hopefully better research, right?
Yes.
So in your case, I think you're hitting on some really beautiful ideas that people need to hear, like don't group everybody as other. Right. Maybe let's be intentional about our study populations and who's included in our sample. That was such a great point. One thing that I was thinking about when I realized that, oh my gosh, you did this all during COVID, was I think everyone can relate to how important your social network is, your social supports, I should say, in being able to engage in activity of any kind. And that had to be really hard for people during COVID. I would imagine that was one of the biggest changes that happened for people. I don't know, how you went about talking to people about that or talking about it per se.
Yeah. I had one question and one survey that had to do with people's confidence to be physically active. That asked how difficult it was, and it sort of asked them to rate on a 0 to 100%. How confident are you that you could overcome this barrier? And one of the questions was, how confident are you that you could find a place that you would feel safe from COVID? And honestly, I did not do an analysis just of that one
Sure.
question. But we definitely had to account for it. I mean, it affected things like where I could meet people to give them the accelerometer device that they wore during their pregnancy, to gather their
Sure.
physical activity information, trying to stand 6 feet away from people with my mask on and
Yeah.
those,
Yeah.
yeah. Yeah.
Wow. So I'm curious if you came into this with your own ideas or hypotheses about what you would find, and if you were able to refrain from having ideas like that, and then how it all turned out.
Yeah, no, I definitely had hypotheses, and my hypotheses were based on another paper that I'd written. This was actually a systematic review of studies, non-intervention studies that had looked to examine what factors influence pregnancy physical activity, and that's where a lot of my ideas about what types of variables I would include came from. Acknowledging the fact that a lot of these studies were cross-sectional, so they were just looking at a snapshot in time, that the populations were mostly white, then, and my study was going to be different. My study was a sample of all Black pregnant people, and I did a longitudinal study, so I did all of these things twice, about 10 weeks apart during their pregnancy, during the second and the third trimester. But I had to start from somewhere. I had to, say, okay, well, these are the variables I'm going to examine. And for my systematic review, it really very clearly demonstrated in that review that it was things that could potentially be modified, like self-efficacy, that seemed to really influence people's behavior. If people were confident that they could be physically active, they were much more likely to be physically active. If they had a habit of being physically active prior to pregnancy, they were more likely to be physically active during their pregnancy. So there were these factors that seemed to reside within the individual that seemed to have much greater impact than whether you were, had a college education, or, what your income was, or, things that I tend to think of as being more difficult to manipulate within an intervention. Maybe manipulate's not exactly the right word, because I don't want to sound like a little, Machiavellian, scheming person that I'm going to get people to do what I want. That's not what I'm trying to say. But it's a lot easier to try to build up somebody's confidence than it is to, change their neighborhood, for example.
Sure.
Yeah.
That's a great point. Are you able to say from your research what activities were the most commonly engaged in, and what types of things maybe you were surprised by because they were the least commonly engaged in?
So one of this is very consistent across the literature, is that the activity that my sample most commonly engaged in was walking. Walking during pregnancy seems to be an activity that lots of different folks are comfortable doing, that they're comfortable, they're confident, they can do it. And I don't think that COVID really changed that a whole lot, because this was an outdoor activity, and that was basically about the only place that we could move around freely, was if we were just outdoors. So that didn't surprise me. One of the activities that came up as not only being an activity that a lot of the folks in my sample engaged in prior to pregnancy, but they also continued throughout their entire pregnancy, was dance. There was lots of folks that were dancing. And I thought, and that is not something that I've seen mentioned. So basically the top two were walking was number one, dancing was number two.
And when you say dancing, I don't know if you can answer this, but do you just mean somebody putting on music in their home and dancing around their house, or semi more structured than that?
It was undefined. However, the person filling out the survey defined dance. That's.
I love that. Yeah. That's really, really cute.
Yeah. But
awesome.
I thought, that once again, that's something that can be sort of infinitely modified, as pregnancy progresses, that it may have been, being very social, being out in a public place and, dancing with your friends prior to pregnancy. And then maybe by the time you got to your third trimester of pregnancy, it was something that you were doing more, slower music, maybe in your own home, I don't know, because I didn't ask those kinds of questions, but that would be a wonderful thing to explore, is to find out more about, what is it, what type of dance, and where are people engaging in dancing, and how did they feel about sustaining that behavior over the course of their pregnancy.
So fun fact about me, I dance Argentine tango. I have
Oh,
for a gazillion years, and I danced it through my pregnancy, which was really interesting to maintain my center of balance while very pregnant, in high heels nonetheless. I don't think
wow.
I could do that now, but I think that's why I was so interested in the dance as an option, because I was definitely the only pregnant belly that was showing up at Argentine tangos.
And that
Back
is
then.
a very vigorous form of dance. That is not for the faint of
I was
heart.
also 19, 20 years old, so just a little context, right? Like I was a dancer and that was something I did for fun.
Well, gosh, we had last night on the Super Bowl, we had Rihanna
I know, that
out
was
there.
crazy. I
That
just
was
saw that too.
wonderful,
That
wonderful.
was so interesting.
Yes, yes, and I am not a football fan, and I
Me
don't know
neither.
what made me turn on the Super Bowl last night, but I watched it, and I was so glad to. I kept looking at her belly. I'm like, I know she had a baby recently. Is this postpartum belly, or is she having a baby?
So I had a similar thing. So my husband was watching it, and I said, "Call me over when the halftime show comes on." I don't normally care, but I had seen a post on Instagram of Rihanna with a very big pregnant belly, and there were like words over top that was a quote from her about how important it was for her kid to see her do this. And I remember being not sure whether she would be pregnant or not. Like that post wasn't clear to me. Anyway, we're watching it and I think she looks a little pregnant, but her belly looks so much smaller than the picture I saw. So then I was confused and Pablo, my husband, says, I think she had a baby recently. And I thought, well, so maybe that's a postpartum belly. I don't know. And then it ended, and sure enough, I immediately saw the headline.
Yes, yes, yeah. But she was, I
uh,
mean, that was some vigorous dancing she was doing.
no kidding. No
Yeah,
kidding.
yeah.
Yeah.
I don't think I could get my hips to move like that. So,
Well, not to mention, she was very brave going up on those floats that went very high up in the air.
yes, yes.
Okay.
Are you pregnant and thinking about what making milk for your baby will be like? Do you wonder why feeding human babies human milk has become so challenging? I'm Lo Nigrosh, a lactation consultant and host of the Milk Making Minutes, a podcast that explores baby feeding through the lens of systemic and cultural barriers. Come listen to others share their insight about their own milk-making experiences and empower yourself to feed your own babies in the way that feels best for you.
So was there anything, just to finish that thought, was there anything that you expected to see people do that they weren't doing at all in terms of just regular physical activity?
I think that the thing that, and this isn't a type of activity, this gets back to my, actual, that device that people were wearing that was measuring their physical activity, was just how little activity people were getting. And I was looking at moderate intensity activity, and I said earlier that this is something that is probably not exactly what we should be doing when we're examining pregnancy physical activity. But the 150 minutes a week of moderate intensity physical activity that we're supposed to be encouraging everybody to get, the sample of people that I had in my study were getting 20 minutes a week of moderate intensity activity. So
Wow.
way below.
So
what
it's
would be
funny, at one
expected.
point I had a question for you that now I can tell is moot, but I think it's an interesting thing to bring up. I initially wondered if putting a monitor on somebody would make them change their behavior from what it typically is at their baseline. And I was thinking, where I was getting that from, I know you're following me already, is when you ask someone to do a food diary, they
Right.
often change their dietary intake because they're already feeling watched. Even without giving them advice or anything, they will often be like, oh, maybe I won't eat that cupcake because my midwife's going to look at this. Like there's that way that people can change their behavior. And I wondered if that would happen. But I'm guessing with these low numbers, that doesn't appear to be the case.
Yeah, I don't think that happened during the study. I very intentionally, when I was talking to people about the study, said, I don't want you to change your
Got it.
regular activity. This is really, I'm wanting to know what you're just doing in your day-to-day life. Yeah, so, but you're absolutely right that, it's so that's that quantum physics thing that, the moment that you observe something, you have changed its nature, and that's
Yeah.
absolutely true when you're studying human behavior as well.
So the other thing, though, that I think comes up in this, and I don't know if, there was a way to make sense out of this, even though I know that in theory you'll agree with me. When we see these low levels of physical activity in pregnancy, how much of that, this is like the big question, how much of that can we attribute to fear of physical activity causing harm? Because that's one of the reasons I'm so engaged in the work that I do, because I think that we as healthcare providers inadvertently instill fear in people, and I think it's a vicious cycle. And I'm wondering if you have any sense of if that's why we see it so low, or if that's just not something we could capture in the study that you did.
So I didn't look at that specifically in my study. What I looked at was whether pregnancy worries as a general statement seemed to influence behavior, and I didn't find an association between that. So,
Interesting.
I used a survey questionnaire called the Pregnancy Distress Questionnaire that asked specifically about, in a number of different domains, things that might concern somebody during their pregnancy, from concerns about their health, concerns about their baby's health, concerns about economic changes in their relationship. So not specifically about concerns regarding physical activity. But in the qualitative literature, that's something that has come up. That people and it's really sort of interesting. It's kind of it's a double-edged sword in that it's sort of if you aren't convinced that being physically active is something that is important and that you value, that during pregnancy people tend to sort of like really stick to that belief. Whereas people who really value being physically active and think it's really important to their health sometimes will go the opposite way, where they will, be very, adamant that I'm going to continue to do my very intense physical activity during my pregnancy. So it sort of cuts both ways. So I agree with you entirely that we have, I think, overemphasized that you must be safe to engage in physical activity during pregnancy, probably to the point that it's been more harmful than helpful. And certainly if you look over time at physical activity guidelines, they have changed wildly. That's a really fun dive if you ever want to get and just look at the literature out there about guidelines for physical activity during pregnancy. I mean, ACOG, American College of Obstetricians and Gynecologists, didn't have their first statement on pregnancy physical activity until the mid-'80s. So,
Thank you, Jane Fonda.
Yeah. Yes. But
I actually don't know if Jane Fonda had anything to do with it.
But I mean, really, you can say that this was ACOG responding to the culture. I think for sure. Yeah. So I think we probably can, at least in part, thank Jane Fonda for that. But if you just look back more at like just sort of general guidelines for being healthy during your pregnancy in the early 1900s, the advice was to pregnant people was to not ride your horse, which makes sense, but that they should walk 3 miles a day. Can you imagine if we sat down with a person in the OB clinic and said, you really got to start walking 3 miles a day?
Well, first of all, we would not say it like that. Now we would tell somebody how many steps that is that they have to take.
That's right. And that would be what, 30,000 steps, I think?
I actually don't know. I feel like I should know, but I'm kind of numerically inept when it comes to like just remembering numbers.
It's way more than 10,000, I can tell you that.
Yeah. I can't remember. I'm like, when I walk 10,000 steps, how many miles does that always turn out to be? I can't even remember.
Yeah.
Anyway.
Yeah. And that's a whole other conversation. That 10,000 steps thing is not like based on like
that
rock
arbitrary
solid
number
science.
that everybody's striving for now.
That's right.
And yet when somebody says it with enthusiasm, I really have a hard time. I just go, I'm not even going there. Like this person's enthusiastic about it. So I'm not going to take that away from
That's right. And that's really, that's where we should be focusing our conversations with folks about being physically active during pregnancy instead of trying to, quote, educate them that it's safe. Being, like I was saying earlier, that people sort of, they come with a set of beliefs. And, it's, I say often, if all it took was education, nobody would smoke cigarettes. I don't know anybody who doesn't know that smoking's bad for them, but I know lots of people that smoke. So education is not the key. So it's not to convince people that being physically active during pregnancy is safe. It's saying, okay, well, where, do you value this? What are your interests in your pregnancy? What is it that it's important to you from this experience? And then, what types of activities or what kind of behaviors, I don't even want to say activities, what type of behaviors would help that person to achieve their stated goals for their pregnancy? And just let them work it through, if there were somebody that, was not physically active prior to pregnancy, is there a time in the past when they ever were active? And what benefits did they perceive from that, and how do they feel that they might realize some of those benefits now? When in the beginning of the conversation we're saying that there's really not a whole lot that pregnancy physical activity doesn't improve. That is true. If you're having a rough time sleeping during pregnancy, which a lot of people say that that's a concern, being physically active can be something that would be helpful for that. It's aligning people's needs and people's values with their behavior.
Well, and to go out on a tangent to something unrelated to this, but, to make that point even stronger, I see this idea in action most commonly for me when somebody's postpartum and they start to say things like, I recognize that I'm going to need to be able to keep up with this baby who's becoming a toddler. Or they'll say, I want to be healthier so that I can enjoy my kid and my family for longer. There's these various wake-up calls that happen for people.
And
I see them a lot postpartum.
That's change talk. That's people thinking about, how can I make a change that's going to improve, meet my goals? If my goal is to be able to keep up with my toddler, what changes? And that's listening for those cues and picking up on them as a clinician is so important. And just saying, wow, yeah, I hear what you're saying, that, yes, toddlers can be a handful to keep up with. What are you thinking about doing? And just, starting the conversation from there. So the whole thing about guidelines and whatever professional organization recommends, blah, blah, blah. If somebody values that, if they explicitly state, I would really like to know what ACOG says about pregnancy physical activity. Share it, If they're talking about how, their major goal is to, not have a preterm birth, that's 150 minutes of physical activity, even though we know that it's associated with lower rates of preterm birth, that number means nothing. But, what behaviors does the person think that they can achieve that's going to help to meet their goal of having their baby at full term? And if sharing information about how being physically active can improve that is helpful to them, great, share it. It might help move the needle a little bit. But I really think, right now, that's really where we need to be focusing the conversation is, to what is important to that individual.
Well, I love hearing glimmers of how it is that you now talk to your clients about this topic. It's really beautiful. And on that note, I want to talk more, and please stop me if there's something else about your research that we haven't gotten to that you want to get out there. But I also want to talk to the people that are considering doing a doctoral program, the midwives that are going to do a doctor of nursing practice or a doctor of midwifery or get a PhD, and all the various other health professionals or birth workers that are considering taking on this huge task. It is something I have thought about over and over and over again. And over and over and over again, I come back to, nope. My reason for nope is deeply rooted in how much student loan debt I still have. And that's the end of the conversation in my mind. But that aside, I think there are people that are ready. They're at a stage of their career and a stage of their life where they're considering this. And I think people have a lot of different feelings about it. Can you talk to us a little bit about your journey to making this decision and what that was like for you and what the experience itself was like?
Sure. So, in a certain respect, the decision was made for me about whether I was going to pursue a doctoral degree or not. And that was because I had taken a faculty position at Frontier Nursing University. And this was in the time period before the program that people were enrolling in was a doctoral program. It was still a master's program, and then we had a postmaster's DNP. But when the program changed so that people were basically enrolling in a DNP program, people like myself who had a master's degree really sort of needed to go ahead and move towards that doctoral degree. So in a way, the decision was made for me because I wanted to keep my job.
That's
But
fair.
then the decision was, do I want to get a DNP, a doctorate in nursing practice, or do I want to get a PhD? And a PhD is a research doctoral degree. So, and I really saw that from where I was in my career that I really, I didn't picture ever being, a full-time clinician again. That really academia was going to be where I was going to stay for the rest of my career. So to me, a DNP didn't make as much sense because it's a clinically focused degree. So I decided to pursue the PhD.
It's
And
such a helpful answer.
yeah, yeah.
I mean, it's so simply stated, but I think a lot of people need to hear that baseline answer before going on from there. That's so important just to make that decision. And how do you make that decision?
Yeah. Yes. If you are, if you are a clinician and that's really where your heart is and where you want to stay, getting a DNP is definitely the way to go. And there are distinct advantages to having a DNP. I mean, the master's prepared midwife or nurse practitioner has got a really solid foundation for engaging with patients one-on-one and operating within a group practice. What the DNP does is it really sort of moves that skill set to the higher level of working within a healthcare system and being able to affect change on a higher level than just the one-on-one interactions that we've been talking about so far in this conversation. So, I mean, it's a worthwhile, in my humble opinion, degree to get just for that reason. It's a lot. It's not that you can't gain those skills without the doctorate, but I think it's always easier to go to an organized program where they're going to teach you these set of skills than trying to seek out the opportunities on your own and identify all the knowledge that you need to gather. So then the research doctorate is really, if you are wanting to be operating on a different level where you are really trying to generate the evidence that's then going to inform clinical practice down the road. So, sort of some of the things that I talked about today in my own research, the idea is that eventually it's going to get to the point where there's an intervention that can be tested to see whether it improves physical activity for Black pregnant people. I actually don't think that intervention is going to reside within the healthcare setting at all. I really think that this is something that needs to reside within the community for a lot of reasons. Healthcare providers, I mean, gosh, all the laundry list of things that need to be taken care of in a quote 15-minute prenatal appointment. Holy moly, you're lucky if you've got all 15 minutes, Yeah. I think that it's tough to really, because it's such an individual decision and requires really sort of like intense time to really flesh out what it is that a person can do to be more physically active, that probably in a non-healthcare setting is probably a better place for that to reside. That's where I am right now in my thinking. I might try out a community-based intervention and think, nope. What I really got to do is get the healthcare providers on board. It may change.
So what have you found most rewarding about this so far?
Oh gosh. Um, I getting this dissertation has it took me 7 years. And and it's not because it's a 7 year degree, it's a 4 year degree, but it took me seven because of some, changes that happened in my life. We all had a global pandemic, and then I had some personal challenges as well, that definitely lengthened out my program. But even if I would have finished it in 4 years, it would have been the hardest thing I've ever done. Just I thought I was a good writer until I started this program. I thought that I was a pretty good critical thinker until I started this program. It was a very humbling experience. But coming out of it, I feel like I have really, really, really developed a very deep well of knowledge about this thing that I was very interested in, pregnancy physical activity, that I can draw on now. I have met some amazing people. I have seen what other disciplines are doing in this area. It's not just, midwives and obstetricians that are, doing this work. There's exercise physiologists are super interested in pregnant people, in a way that I didn't appreciate until I had started this degree. So,
well, that's why I like the Canadian guidelines more I like the Canadian guidelines around exercise in the perinatal period more than the ACOG ones to begin with for other reasons. But they did that statement jointly with exercise physiologists. And I was like, right on. Good for you for working together. That's what it should be.
Yeah. We all need to get out of our silos, right?
Yeah, totally.
Yeah, start talking to people. Yeah.
So I was going to ask you what your biggest challenges were too, and I think you may have just spoken to that. That really was interesting to hear you say that you thought you were good at these things. And so I'm going to guess that you were already good at them, but that change and learning can be so hard that now you're just catapulted to another level. But do you feel in retrospect like you were not good and now you are, or what's that like?
Scientific writing is really different. Writing a research paper is just a really different. It's kind of like I took 1 semester of journalism and learning how to write for media. And it's just a really different way of doing things. And so that's I think really what I mean. It's not that, I had poor grammar or something like that, before I started this program, or, wrote in incomplete sentences. It's just I didn't have the technical skills. And really for about the first 2 years of the degree, I would listen to my professors talk, and it was almost like I was listening to somebody speak a language that was sort of like English, but not exactly English, and their minds just worked so differently. Like they could see things that I was just like, wow, they're like operating on a whole different level than me. And that's really, that was a very humbling experience, because, I thought of myself as, I'm a faculty member at a university. You're a faculty member at a university. We have so much in common. And I think it gets to be that, I teach midwifery students, and I see that same sort of role transition from RN to CNM, where they're like, I'm a labor and delivery provider. I'm a labor and delivery nurse. You're a labor and delivery provider. You're a CNM. We have so much in common. And yes, that you do have a lot in common with that person, but, with each other. But, once we start talking about clinical management and start talking about all of the pieces that need to go into making clinical decisions, the RN sort of says, wow, there's a bigger role transition here than I thought. And I was going through that same process.
Well put.
I
love it.
Being a clinically focused midwife to being an academically focused nurse researcher.
So I think that speaks to one of the most common things we all go through with growing pains, but possibly also, I don't know, I want to say women-dominated professions probably have this more. and that is imposter syndrome. Like, would you say that you experienced outright imposter syndrome or not quite at that level?
I don't think I really don't think that I dealt a whole lot with imposter syndrome. I mean, I'm a little bit older. I'm 53, and I think that some of that's just a function of age. I've been around the block.
Cool.
And I definitely can see the value in my previous life experiences and how they apply to what I'm doing now. And I think that that's really helpful. Does that mean that I was never intimidated or felt like I was like, like maybe in the deep end of the pool a little sooner than I wanted to be? Absolutely. I definitely had uncomfortable moments, where I was like, oof. Yeah, the first I presented, not my dissertation research, but another secondary analysis that I had done at a research conference at Rush University, where I got my doctoral degree shortly after the pandemic, when we could all be in public together again, but everybody was masked, and it was in one of those like traditional medical theaters, where like the seating goes straight up. And these were, people from the College of Nursing, people from the College of Medicine, very esteemed, faculty and researchers and administrators. And I just remember standing down in the well and looking up and just thinking, holy moly, how did I get here?
Wow.
Yeah.
So, on a final note, do you have a piece of advice that you would give to somebody embarking on a similar journey?
So I got a really good piece of advice from one of my co-faculty when I started my PhD. And I think that this applies to whether it's a DNP or a PhD. It's a marathon, it's about endurance. If you just keep moving forward, you will finish. Basically, and I think that that's true. And I would say the same thing for somebody who's considering moving from a BSN to an MSN. In that, if you have been accepted into the program, you have everything that it takes to finish the program. You would not have been accepted into it if you did not have the chops to finish it. The tough point is just continuing to move forward and, in the face of those obstacles, saying, you know what, I may not be able to focus 100% on school right now, but I'm not going to let school go because this is still very important to me. And if you can do that, you will finish, you will be successful.
Awesome. Anything else you want to add before we part ways?
Tanya, I really enjoyed writing that book chapter with you. I thought that our skills complemented each other, our different domains of our interests in pregnancy physical activity. I thought complemented each other so well and made it an incredibly strong book chapter, and I'm really looking forward to seeing it in print.
Me too. Thank you so much for talking to me and for letting me experiment with taking on an academic on this show, because it's definitely a first, and we're going to follow this episode with one more, another colleague of mine from Georgetown who's going to talk about her work next episode. So I feel like I broke the ice on doing something a little bit harder on the podcast. Thank you so much for joining me today.
It was absolutely my pleasure, Tanya.
Thank you for listening to the Mother Whip podcast. If any of the issues we discussed today resonate with you or your experience, I'd love to hear from you. Leave me a voicemail at 917-310-0573, or better yet, email me a voice memo at tanya@motherwhipmaternity.com. I really want to hear what worked for you, what didn't work, what support you'd wished you had, how you got through the tough times, how you advocated for yourself, or especially any tips you want to share with our listeners. I want to hear all of it. And if you'd really like to work together, you can get a discount on your first consultation with me at motherwhipmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. Okay, that's all. It's wonderful being in community with you all. Thanks again for listening, and see you next time.
And remember, listeners, nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your health care.